I have something called spasmodic dysphonia, where the vocal cords seize kind of, and then that causes breaks in my speech.
Essentially, her voice issues make it difficult for her to speak for long periods of time. Speaking is very effortful and requires a lot of concentration to be able to communicate with the voice effectively.
I ended up in the hospital with dizziness. The morning that the dizziness started, I immediately went totally deaf in my left ear.
The hearing loss sort of compounded the issue because then she had a lot of trouble hearing what people were saying in addition to being able to speak effectively.
When my voice was going away, then my hearing went away, and I already had these tremors, and I thought, this just isn't fair. So I would go through rounds of being depressed.
As you become more socially withdrawn, depression certainly is pretty common in patients who have really severe hearing loss. We also know that patients who have significant hearing loss are at increased risk for dementia.
When I read that hearing loss and dementia are related, I wanted none of that. So if you can fix it, please do.
She was a candidate for cochlear implantation in her left ear, and so we were able to do that procedure for her actually on her birthday, which was one of the best birthday presents I've ever given someone, was to put her cochlear implant in. And so now she's about 6 months out from her initial activation and is doing really well.
The sound it's become more normalized, and I can hear more evenly on both sides of my head.
The implant has made it really much easier for her to hear what people are saying and understand what they're saying. And she's adapted to this new information because the information you get from a cochlear implant is different than natural hearing, and that process takes time. But the brain is able to figure that out, which is one of the most amazing things about this technology is that we're able to adapt to it.
My cochlear implant gave me back freedom to be independent